According to a new study in the Archives of Surgery, men and women experience the symptoms of heartburn and acid reflux differently. Researchers followed 5,000 men and women who were having surgery to correct their GERD. Women complained of more frequent and severe heartburn than men and reported having more trouble swallowing solid foods. Men reported more physical manifestations of acid reflux disease and were more likely to have weak valves where the esophagus meets the stomach. The specialists at Advanced Gastroenterology and Surgical Associates explain what acid reflux is and how to treat it.
Gastroesophageal reflux disease. It is a chronic condition. That is when acid in the stomach refluxes up to esophagus. It has to do how the motility of the esophagus is. So in conditions where the esophagus does not function well to clear the acid when it is refluxed up, that's one. The intra-abdominal pressure is very important as well. It also has to do with the anatomy. So for example, if at the end of the esophagus is the lower esophageal sphincter, if that for one reason or another due to connective tissue disease or prior surgery is quote-unquote loose, then acid can reflux a lot easier.
People with hiatal hernias, where part of the stomach is slid up into the chest, tend to be more prone to get acid reflux, and they tend to have more significant problems. But it really is a motility disorder. The medications, however, that we have actually just control the acid. They don't really prevent the reflux of gastric contents. That's why the anti-reflux measures, elevating the head of the bed, avoiding lying down postprandially, avoiding some types of food, some medications are vitally important, because you really have no great motility drugs to treat acid reflux.
A couple of food right off the bat, which I ask my patients to avoid when they come in. Tomato products, and not the fresh tomatoes, is actually the tomato sources. So in your lasagna, spaghetti, and pizza, now that goes along with citrus, so your oranges, grapefruits. But believe it or not, peppermint can also cause that. And then also chocolate has been blamed on, as well as caffeine.
We're seeing more and more cases of acid reflux, and the other reason it's important in men is that there's rising esophageal adenocarcinoma of the esophagus through a condition called Barrett's esophagus, and it's much more common in men than in women. So anyone who has a chronic history of acid reflux should probably have an endoscopy. That way we can sort of prevent them from developing adenocarcinoma of the esophagus.
Approximately 1% of all people in the United States who are diagnosed with GERD also have a condition called Barrett's esophagus, which is commonly found in Caucasian men. For more information on the specialists and procedures available at AGSA, please click the GERD story link on our homepage, yourhometownhealth.com.